Did you know your blood pressure might be silently damaging your organs right now? Here's what you need to know. Think of a high pressure water jet. It's great for blasting off the dirt out of your driveway or cutting a steel even, right? But it's obviously the elevated blood pressure in your organs might be damaging your delicate tissues or organs. Hypertension is one of the leading causes of global burden of disease, and hypertension doubles the risk of cardiovascular diseases like coronary artery disease, congestive heart failure, ischemic heart disease, that is strokes, hemorrhage, this kind of things. Even renal failure, also peripheral arterial diseases like Reynolds phenomena, which I'll explain later. According to American Heart Association's latest guidelines, blood pressure below 120 over 80 mm of mercury is called as normal blood pressure. Anything above that, even 121 over 81 mm of mercury, is called to be an elevated blood pressure and needs to be addressed. Also, I'm telling you one thing about low blood pressure. You will probably be curious about it. What is a low blood pressure? It is called as hypertension in our medical terms. It is a pressure which is less than 90 over 60 mm of mercury. When you should consider it to be a problem, when you get symptoms like dizziness, you're fainting, or you have extremely fatigue after your minimum work or anything. This thing need to be addressed then. What is the lifestyle modification you need to do to manage your hypertension or lower your blood pressure? Well, number one, obviously you guessed it right, it's weight reduction. Keep your BMI less than 25. Number two, restrict your salt to less than 6 grams a day of sodium chloride. Number three, adopt a DASH diet. I'll come up with a detailed video in my next upcoming videos. Follow me for that. In a brief, DASH diet, which contains mainly of fruits, vegetables, and low-fat dairy products, and especially low-insaturated fats and everything. Number four, I've already told it, stop drinking alcohol or limit your alcohol consumption. Men drink less than 2 glasses per day, and women less than 1. Number five, sleep well, at least 6 to 8 hours daily. Number six, of course, do aerobic exercises like a brisk walk for 30 minutes at least a day. And still, if your BP isn't lowered or it's constantly high, you need to consult your general physician immediately about this, because blood pressure is a silent killer. Remember that. So stay healthy, eat healthy, sleep well, take care of yourself. See you in my next video. Bye bye.